Hello, greetings to everyone and welcome to our lecture video. Today we will discuss about cluster A personality disorders. I hope you can learn something from our discussion. Let us begin. So cluster A, or the weird or eccentric type of personality traits. We have three types of this personality. We have paranoid, schizoid, schizotypal types. As we go along, you will notice similarities between these types, and you will notice that these traits have its similarities and connection with schizophrenia, a type of major mental illness. However, they are not the same or distinct and should not be mistaken for each other. We will discuss this in detail as we proceed. So, paranoid personality. The typical feature is suspiciousness and pervasive distrust to others. Prevalence of this is around 0.5 to 2.5% of general population. A paranoid personality is characterized by persistent pattern of fear, mistrust, and suspiciousness of other people. People with these disorders believe that people around them are deceiving or exploiting them and will doubt the loyalty of family and friends and often harbor suspicious feelings of their partner being unfaithful to them or their friends betraying them. Because of this, they tend to start argumentative and threatening stance when criticized and become sensitive, and they get easily mad or angry. Take note that this behavior tend to direct at their close relatives and family members rather than anyone that they are not closely associated with. They will become isolated for the fear that people around them only wants only wants them to get punished or to hurt them. It is also characterized by extreme and inflexible low agreeableness through the lens of ocean model that we have discussed in the previous video, if you could still remember the big five personality traits. So while paranoia is also a characteristic of schizophrenia, the difference between the two is that schizophrenia's paranoia tend to be complex but stable paranoia delusion, while in contrast, the paranoid personality paranoia are constantly jumping into different paranoia ideas. So paranoid personality evolves evolving in constant, while schizophrenia is often fixed. So the clinical features is listed here. So the pervasive distrust with suspiciousness, sensitive and argumentative. They show suspicious to spouse or friends. They appear guarded, tense, and may avoid involvement in group. They scan the environment for clues of betrayal or attack. The tendency to bear grudges persistently and refuses to forgive insults. They also have these ideas of reference. So ideas of reference is that they don't believe in coincidence, but everything that happens is for a reason. For example, a certain situation is always related to them, the environment, the people around them. It's like that they are the main character and they don't believe in coincidence. So they believe in both extreme. So the extreme relationship with this phenomenon. So that is a form of delusion and that tends to affect their judgment and insights. So the tendency to experience self-importance is also very high. Tendency to distort experiences or neutral actions of others. So what is the prognosis of this personality disorder? So this is a lifelong in some people, but it also treatable and manageable. It often also leads to the development of paranoid schizophrenia. They will have problems in adjusting with others in work and in family life. The treatment often includes psychotherapy and pharmacotherapy, which includes the use of medications like anxiolytics, antidepressants, and antipsychotics to deal with the symptoms of agitations and anxiety and delusional thinking. So next, we have the schizoid personality. The characteristic feature is social withdrawal or detachment from others. So avoidance is the key term. So this personality is characterized by consistent lack of interest in social relationships. They want solitary activities and disinterest in intimate relationship. They often have difficulty in experiencing pleasure and lack of close relationship even with their family members. So the word is aloof and extreme introvertness. They are indifferent to praise and criticism and have lack of confidence. So I have listed here the clinical features. So they are emotionally cold and have restricted emotional expressions, detachment from other people. They tend to keep distance from their family members, interest in solitary activities, so introvertness, lack of interest in sexual experiences, and they are often self-absorbed and aloof. So the key word is isolation and aloofness. Though they tend to be alone, it doesn't mean they don't get lonely. Of course, as a part of normal emotion, they sometimes get lonely. But these people tend to be left alone with their own. And like other cluster A personality disorders, schizoid also overlaps with schizophrenia, with asociality is often the common features of the two. However, the key difference and point to remember is that schizoid asociality is more conscious and intentional. There is still insights and judgment or decision that they are aware, unlike in schizophrenia that negative symptoms are more likely the cause of their inability to connect with other people. So what is the prevalence? Though the prevalence of this is not clear, it affects 7.5% of general population. Schizoid personality disorder also starts in early childhood and is often long lasting but may not be lifelong. The management includes is psychotherapy. So there is no specific drugs, but psychotherapy can help. Lastly, we have the schizotypal disorder. So this is characterized by odd or magical thinking, having an eccentric behavior, and pervasive problems in social relations. They believe in telepathy and obsessed with paranormal experiences. So the clinical features often involve social anxiety, inability to make close relationship, odd behavior, odd speech, and the ideas that influence behavior, inappropriate affect, suspiciousness or paranoia, idea of reference, just like we have discussed before, unusual experiences that are not consistent with cultural norms. They are not also aware of their own feelings, but aware and sensitive to others' feelings, like anger and joy mood, joyful mood. They are socially isolated. They often have difficulty relating to other people, which leads to loneliness and isolation. However, in contrast to schizoid personality, the avoidance is often out of fear of judgment because of their odd behavior, eccentric lifestyle, and unconventional thinking. So, schizotypal can be considered as the premorbid personality of schizophrenia patients. Some of them maintain it as stable personality, but since it is often referred to as low-grade schizophrenia that is yet to develop into full-form diagnosis in the future, uh, these people tend to have similar core symptoms of schizophrenia, but in a low grade or low intensity compared to a full-blown schizophrenia disorder. So always seek support. Don't hesitate to ask for help if you're struggling. It's important to seek support. Don't be afraid to reach out to a friend, adult, family members, or seniors. So, those are the three clusters A personality disorders. Thank you for listening, and I hope to be with you again in our next lecture video. In the next video, we will be discussing cluster B personality disorders. I hope to see you again, and good night. Thank you.